A recent study, for example, found that only half of all cardiac guidelines are based on scientific evidence. Half. That means doctors may be doing a bypass operation when placing a stent is equally effective. Or placing a stent when adjusting a patient's drug and medical management is. Equally effective, all of which drives up costs without improving a patient's health. So one thing we need to do is to figure out what works. And encourage rapid implementation of what works into your practices. That's why we're making a major investment in research to identify the best treatments for a variety of ailments and conditions. Now, let me be clear, I just want to clear something up here. Identifying what works is not about dictating what kind of care should be provided. It's about providing patients and doctors with the information they need to make the best medical decisions. See, I have the assumption that if you have good information about what makes your patients well, that's what you're going to do. I have confidence in that. We're not going to need to force you to do it. We just need to make sure you've got the best information available. Still, even when we do know what works, we are often not making the most of it. And that's why we need to build on the examples of outstanding medicine at places like the Cincinnati Children's Hospital, where the quality of care for cystic fibrosis patients shot up after the hospital began incorporating suggestions from parents. And places like Tallahassee Memorial Healthcare. where deaths were dramatically reduced with rapid response teams that monitored patients' conditions. And multidisciplinary rounds with everyone from physicians to pharmacists. And places like Geisinger Health System in rural Pennsylvania, and Intermountain Health in Salt Lake City. Where high-quality care is being provided at a cost well below the national average. These are all islands of excellence that we need to make the standard in our healthcare system. So replicating best practices, incentivizing excellence, closing cost disparities, any legislation sent. To my desk that does not achieve these goals in my mind does not earn the title of reform. But my signature on a bill is not enough. I need your help, doctors, because to most Americans you are the healthcare system. The fact is Americans, and I include myself and Michelle and our kids in this, we just do what you tell us to do. That's what we do. We listen to you. We trust you. And that's why I will listen to you and work with you to pursue reform that works for you. Together, if we take all these steps, I am convinced we can bring spending down. Bring quality up, we can save hundreds of billions of dollars on healthcare costs. While making our healthcare system work better for patients and doctors alike. And when we align the interests of patients and doctors, then we're going to be in a good place. Now, I recognize that it will be hard to make some of these changes if doctors feel like they're constantly looking over their shoulders for fear of lawsuits. I recognize that. Don't get too excited yet. Now, I understand some doctors may feel the need to order more tests and treatments to avoid being legally vulnerable. That's a real issue. Now, just hold on to your horses here, guys. I want to be honest with you. I'm not advocating caps on malpractice awards, which I personally believe can be unfair to people who've been wrongfully harmed. But I do think we need to explore a range of ideas about how to put patient safety first. How to let doctors focus on practicing medicine, how to encourage broader use of evidence-based guidelines. I want to work with the AMA so we can scale back the excessive defensive medicine that reinforces our current system. And shift to a system where we are providing better care, simply rather than simply more treatment. So this is going to be a priority for me. And I know, based on your responses, it's a priority for you. And I look forward to working with you. And it's going to be difficult. But all this stuff is going to be difficult. All of it's going to be important. Now, I know this has been a long speech, but we got more to do. The changes that I have already spoken about, all that is going to need to go hand in hand with other reforms. Because our healthcare system is so complex and medicine is always evolving. We need a way to continually evaluate how we can eliminate waste, reduce costs, and improve quality. That's why I'm open to expanding the role of a commission created by a Republican Congress called the Medicare Payment Advisory Commission. Which happens to include a number of physicians on the commission. In recent years, this commission proposed roughly $200 billion in savings that never made it into law. These recommendations have now been incorporated into our broader reform agenda, but we need to fast-track their proposals. The Commission's proposals, in the future so that we don't miss another opportunity to save billions of dollars. As we gain more information about what works and what doesn't work in our healthcare system, and as we seek to contain the cost of healthcare, we also have to ensure that every American can get coverage they can afford. We must do so in part because it's in all of our economic interests. Each time an uninsured American steps foot into an emergency room with no way to reimburse the hospital for care, the cost is handed over to every American family as a bill of about $1,000 that's reflected in higher taxes, higher premiums, and higher health care costs. It's a hidden tax, a hidden bill that will be cut as we insure all Americans. And as we insure every young and healthy American. It will spread out risk for insurance companies, further reducing costs for everyone. But alongside these economic arguments, there's another, more powerful one. And it is simply this: we are not a nation that accepts nearly 46 million uninsured men, women, and children. We are not a nation that lets hard-working families go without coverage, or turns its back on those in need. We're a nation that cares for its citizens. We look out for one another. That's what makes us the United States of America. We need to get this done. So we need to do a few things to provide affordable health insurance to every single American. The first thing we need to do is to protect what's working in our healthcare system. So just in case you didn't catch it the first time, let me repeat: if you like your healthcare system and your doctor, the only thing reform will mean to you is your healthcare will cost less. If anyone says otherwise, they are either trying to mislead you or don't have their facts straight. Now, if you don't like your healthcare coverage or you don't have any insurance at all, you'll have a chance. Under what we proposed, to take part in what we're calling a health insurance exchange. This exchange will allow you to one-stop shop for a healthcare plan, compare benefits and prices. And choose a plan that's best for you and your family the same way. By the way, that federal employees can do, from a postal worker to a member of Congress. You will have your choice of a number of plans that offer a few different packages. But every plan would offer an affordable, basic package. Again, this is for people who aren't happy with their current plan. If you like what you're getting, keep it. Nobody is forcing you to shift. But if you're not, this gives you some new options. And I believe one of these options needs to be a public option that will give people a broader range of choices and inject competition into the healthcare market so that force so that we can force waste out of the system and keep the insurance companies honest. Now, I know that there's some concern about a public option. Even within this organization there's healthy debate about it. In particular, I understand that you're concerned that today's Medicare rates, which many of you already feel are too low. Will be applied broadly in a way that means our cost savings are coming off your backs. And these are legitimate concerns, but they're ones, I believe, that can be overcome. As I stated earlier, the reforms we propose to reimbursement are to reward best practices. Focus on patient care, not on the current piecework reimbursements. What we seek is more stability and a healthcare system that's on a sounder financial footing. And the fact is these reforms need to take place regardless of whether there's a public option or not. With reform, we will ensure that you are being reimbursed in a thoughtful way that's tied to patient outcomes. Instead of relying on yearly negotiations about the sustainable growth rate. Formula that's based on politics and the immediate state of the federal budget in any given year. And I just want to point out the alternative to such reform is a world where healthcare costs grow at an unsustainable rate. And if you don't think that's going to threaten your reimbursements and the stability of our healthcare system, you haven't been paying attention. So the public option is not your enemy, it is your friend, I believe. Let me also address a illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system. I'll be honest, there are countries where a single-payer system works pretty well. but I believe, and I've taken some flack from members of my own party for this belief, that it's important for our reform efforts to build on our traditions here in the United States. So when you hear the naysayers claim that I'm trying to bring about government-run healthcare, know this: they're not telling the truth.